Nigerian doctors are known to be among the most dedicated and resilient in Africa. They are highly trained, many undergo rigorous medical school education followed by housemanship, national service, and continuous specialization. Despite this, the medical sector in Nigeria faces deep-rooted challenges like poor remuneration, workload and burnout, infrastructural decay, and security threats in some northern parts of Nigeria. Recently, the Zamfara State government raised doctors' pay to combat brain drain and a failing health system, showing that valuing doctor is an investment in survival, not a cost.
It's a good move on his part, on the governor's part, because I went to read up about the state, he has done tremendously well since the past 2 years when he became a governor. So he has renovated the hospitals, renovated so many things. So if you can't do all that and your workforce is not happy, when you talk about management, the most important thing in any organization is the manpower. So when your manpower is happy, they are satisfied, and they're going to stay. So I think it's just a wise move on his part to increase the salary. So because what are the issues? What are the likely causes that doctors and other health workers are leaving? The remuneration, the salary they get, the state of where we work, of course, the security in the country. So if you can touch up, you can renovate these hospitals. But if it doesn't increase the salary, people will still leave. So I think I think he has very good advisors. So I think it's a very good move on his part. Then, so far, the federal government too is trying to start this housing scheme for medical health workers, not only doctors. So, and I think it's also a good move. But the point is, from previous ones, because that's why people are skeptical. We hope that when they finish building these houses, the people that bidded for them would get them. Some politicians will not come and overtake these buildings. So I think the governments, both state and federal, I think they're gradually working towards, because if people are not happy, I know that some states in the north, the governor actually builds houses for teachers, doctors. If the food is not expensive, if there's security there, what do you want to go and look for in another country, in another continent, where you will always be a second-class citizen?
Despite this move, the Nigerian Medical Association, NMA, Zamfara State branch, has expressed concern over level of brain drain in the medical sector as a result of insecurity in the states.
So what the Zamfara State government has done is really encouraging, and I really know that it will change the dynamics of how healthcare is in Zamfara, thereby changing the trajectory significantly. Because I know for one that one of the major reasons why we have many healthcare workers, not just medical doctors, I mean all healthcare workers travel abroad, is because of the poor remuneration in Nigeria. And it's been fought for a very long time with no one, no one listening, or I would say that nothing significant has been done, maybe because the line budget is not improved and because of the minimal inflow from different areas, whereby Nigeria really focuses only on oil and gas. Peradventure, if Nigeria begins to look into getting income from other sources, I know that for sure many other things will be improved. But with one or two major sources of income, many other things are affected negatively. Part of it is the healthcare and the healthcare workers' remuneration.
The association also called on federal government to step up the fight against banditry in the northern region, adding that the situation is worsening by the day and has overwhelmed the already fragile health sector in the state.
Where there's this security, it's just there's this inverse, there is a direct proportion. There's this direct proportionate relationship between these two things. When there's insecurity, the healthcare system starts to fail. So he has paid attention, and I want to believe that in all sincerity, this should be the motivation behind what he has done. Trying to balance the equation. Okay, there's insecurity, we have lots of people who are displaced, hospitals have been destroyed. What can we do to make doctors stay in those areas where quote and unquote may not be conducive? Can we bring in some incentives? Can we make the place more attractive? Can we make their remuneration better? So that should be the motivation that I want to believe that's what motivated him and inspired him to make that move. It's a good move, and I want to assure him that his people will reap the effects. We will reap the seed of what he has sown.
Nigerian doctors have the passion and potential to serve, but without urgent action to end banditry and restore peace, they will keep living, making it harder to create a safe, thriving environment for workers and investors. Sydney Okafor for Anchor News.